Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Heather Mercer, and she is Executive Director of Immunize Arkansas. Heather, thanks for being here.
Thanks for having me.
So let's talk about Arkansas and how we're doing nationally for vaccinations.
So we are doing a lot better than we have been. We've got some statistics that are from 2022. That's the most current numbers that we have. And we're actually above the national average in several vaccines. We're above the national average in the meningitis vaccine for ages 13 to 17 and the measles, mumps, rubella vaccine, as well as Tdap and Hep B. So we're doing a lot better than we were like right around COVID, and it took us a while to catch up. But we are doing better in those vaccines.
And HPV is also one that we hear about a lot. How are we doing for HPV?
We're still below the national average, and boys are still below girls in getting their vaccines. The boys have never caught up to the girls. So, and you know, I had someone ask me last week if boys need to get vaccinated. So I think there's still a lot of education that needs to happen for boys and girls to get vaccinated for HPV. The vaccine has been out since 2006, and it's just, you know, there's still a lot of people that don't understand who needs to get it and when they need to get it, and so we've got a lot of work to do.
And speaking of work, there are some opportunities. You're working with dentists.
Right.
Tell us about that program.
Yeah, so we got a grant from the Delta Dental Foundation, and we are going to be educating. We're going to be going into 20 dental clinics in the counties where the vaccination rate for HPV is the lowest. And we're going to be doing lunch and learns for dental clinics, and educating the whole office. And the reason for that is because oropharyngeal cancer attributed to HPV is the highest. It surpassed cervical cancer in the number of cancers caused by HPV now. So we want to get the dentists involved so they can educate their patients on, you know, HPV and oral cancers. And then we are also, we've developed a webinar that's going to be on demand for all the other dental clinics that we're not able to reach live.
And August is National Immunization Awareness Month. And
Right.
so what do you want people to know about that?
Well, it's just a way for us to, you know, bring more awareness to immunizations. I think part of the reason they do that is because of back to school. So, but we don't want everybody to wait until school starts to get their back to school immunizations. But we also do a summit in August. It's our immunization summit. And this will be our 8th year to do the immunization summit. And we offer continuing education for providers. We offer CE for nurses, physicians, pharmacists, and physician assistants. This year we're offering 6.75 hours of CE, and our registration fee is relatively cheap for 6.75 hours. So the registration is on our website. It's immunizear.org, and registration ends, I think, like the very 1st of August. It's August 9th is when our summit is, and it's at the Wyndham Hotel in North Little Rock. We're not doing a virtual option anymore, partly because we like the interaction with the providers. It gives them an opportunity to share like best practices, and a lot of good comes from having that interaction in person.
And it's for any provider in the state?
Yeah, yep.
And so we talked about a little bit about upcoming events. What are you wanting healthcare providers to know as they seeing patients as we approach the school year ahead of us? I hate to say that it's coming sooner than we realize, but what are the things that they need to really focus in on for their patients and to get kids ready for school?
Well, I think, you know, right now we're seeing uptick in measles around the country, and part of that is because of misinformation around the measles vaccine. So providers need to be on the lookout for like measles, because we are seeing people refuse the measles vaccine because they still attribute it to autism, which we have seen over and over again, studies done that measles vaccine does not cause autism. And providers just need to be patient with parents asking questions. Just because a parent asks a question doesn't mean that they're refusing the vaccine, they just want more information. So if someone asks a question about something, answer their question, don't dismiss the question, answer it with science-based information, and let them make an informed decision.
And there is a meningitis vaccination out as well, and that is different. Requirements are different for different colleges, different states. What do you want the healthcare community to know about that one?
So meningitis vaccine is required for 7th grade school entry. So most kids have had the meningitis vaccine when they go into the 7th grade, and then there's a booster at age 16. Arkansas colleges don't require the meningitis vaccine, but wherever your kid is going to school, you need to check whatever vaccines are required for that school. For Arkansas, the measles vaccine is required to go to college. That's why they ask for your vaccination records. Some states require meningitis. Some states don't, but the schools do in those states. So it's just important to check whatever school your kid is going to, what the school's requirements are.
It can be tricky, especially with the states not all having the same rules too.
Yeah.
Well, Heather, thank you for being here today
Sure.
and talking about these important events. And for more information about your summit that's coming up, they can go to your website.
Yes, immunizear.org.
Okay, well, thank you so much for being here today. And that's it for this episode of AFMC TV. Thanks for watching and have a great day.